So I talk a ton with people all day long about, hey, where is the tube of the bladder? If they're going to put hyaluronic acid, which is all formulated for the floor, right? Or maybe they have their estrogen and they're using a plunger and the tube of the bladder is still not doing well. The periurethral tissue is not really holding on to that tube and keeping it nicely aligned. Some of my people will be like, man, nothing's working. I always feel like I never void all the way. I feel like the bladder is always really full, but I don't really know how to put on this stuff that you just gave me. And I'll just tell you what happens is then I made this crazy picture. And this is just the vaginal opening here. So I just want you to imagine like this is the opening of the vaginal vault. These happen to be muscles that surround this whole area. The tube of the bladder lies right here at the 12 o'clock. So the urethral sphincter is here. You have clitoral bulb up here. So all of these, this is mons pubis, right? We call this mons right up here, right? The tube is going to lie in here. So I want you to understand, we're not talking about plunging things in there anymore of estrogen. Like I want you to take the estrogen, or whether it's the HA by Good Clean Love or Kindred or all the different makers that are out there, right? I want you to actually put it on your finger. If I know the tube is here at 12 o'clock, then you need to have it on your finger. And remember, you need to go into the depth of about this far. So that index finger, you have it on there and you're going to go all along the tube here and all along either side of the tube. Why are we doing that? Because we're trying to help the fascial tissue, they call it the periurethral tissue, that lies beside the tube, okay? We're trying to help all of that fascial tissue that lies beside the tube to actually build up its resilience. If we don't know where we're actually putting it, it doesn't help us stabilize that. So that has to be put on both sides. And if we were going to call it, what is it on the clock? It would be like, hey, at 1, 2 o'clock, I'm putting that in, right? At an 11, 10 o'clock on the other side, I'm putting it in. And it has to be at the whole length of your finger, because you don't get to the base of your bladder until you're in that far. There's a lot of data right now that shows that as soon as estrogen is dropping in perimenopause, menopause women, that the tube of the bladder then will kink or it will fall and it drops. So it'll have a little drop position just like this. So I made this crazy picture because I need to show people where it is, because sometimes you need the 3D. So excuse my crazy picture.